Hello, friends, welcome back to my channel. Today I'm back with another topic, and today's topic is endometriosis. It is a very important topic. We see many patients suffering with endometriosis, and it does impact the quality of life. If you are watching this video, it may be that you have been diagnosed with endometriosis, or you are suffering with chronic pelvic pain and you want to know a bit more about endometriosis. So I will be just covering the basic information about endometriosis. What is endometriosis? What are the symptoms? How do we diagnose it? And what are the treatment options? If you have any question, please leave in the section in the comment section below, and I'll get back to you. So first of all, what is endometriosis? So any endometrial tissue outside the womb, we call it endometriosis. It is a estrogen dependent. So whenever during each menstrual cycle, the endometrial tissue which is outside the womb also bleed, and which causes scarring in the pelvis and leads to the chronic pelvic pain. Um, it can be anywhere outside the womb. It can be in your pelvis. It can involve your fallopian tube. It can be in your ovaries. In the ovaries, it normally forms a cyst, which we call endometrioma. It can involve your bladder head, and it can involve your back passage. So basically, it can be anywhere outside the womb, and the symptoms normally depends on where the tissue endometrial tissue endometriosis is, but normally it's a cyclical symptoms with each period. You normally suffer with the painful periods. You can have pain during the sexual intercourse during that time. If it involves your back passage, you can have painful defecation. If it involves your bladder, you can have pain when you pass water. Sometimes you can have pain, full rectal bleeding. So the symptoms varies from person to person. It also depends where the endometriosis is, but normally you will have the cyclical symptoms. So if you have any of these cyclical symptoms and you think you have got endometriosis, you can contact your GP. They can always refer you to the specialist for further workout. When it comes to the diagnosis, we normally take a very good clinical history. We ask about for how long have you had these symptoms, about your sexual history, about if you have tried any medication in the past and did it help you with the and also about your fertility, if you're trying to conceive, because endometriosis is associated with infertility. And also if and you have got any significant past medical or surgical history, then we examine you. The examination normally involves feeling your tummy, and then doing the internal examination where we do the vaginal examination, feel with the hand inside the vagina to see if you have got any painful area in the vagina, or if you have got any nodes there. And then normally we can offer a ultrasound scan. We can offer you a scan which involve the abdominal scan and the transvaginal scan. Or if we think you have got the extensive endometriosis, we can offer you a special scan which we call MRI. And sometime after imaging, and after trying the basic treatment, or if you are not keen to try any hormonal treatment, and the imaging are negative, and we still suspect that you have got endometriosis, we can offer you diagnostic laparoscopy, which is a camera test through your belly. When it comes to the treatment options, so we offer you a painkiller, then we offer you different medical hormonal treatment. The best is to try combined pills, and we normally ask you to take back to back for 3 to 6 months time. If the symptoms are improving, that's when you have got endometriosis, and then we just continue with the treatment. And the aim is to reduce the amount of cycles of periods you're having in a year, to decrease the scarring in the pelvis, and then which will help with the pelvic pain. If you can't take hormonal treatment, or you're not keen to have it, the next option will be to give you special type of injection. these injections, they put you in the menopausal state, and we normally offer you HRT with these medication, with these injection, and with the GnRH injection, if your symptoms are improving, that's when you have got endometriosis. Then they can discuss the long-term management plan with you. So you can have any of these treatment, and if at the end, if we feel like the symptoms are not improving, or if you're not keen to have any of these medication, they can offer you diagnostic laparoscopy, and with it, if they find endometriosis, they normally treat it. When it comes to the treatment, they can either burn a small endometrial area, or they take it out and send it to the lab. If you have a cyst in the ovary, they normally take it out. If you have got deep endometriosis inside the pelvis, they normally remove it. And at the end, if you're not keen to have more children, then they might, or and you have got extensive disease, they might just offer you hysterectomy. So the surgical options varies from person to person. Sometime if you're having a diagnostic laparoscopy, diagnostic camera test, they might not find anything, so just keep in mind that it might be negative, because sometimes if you're suffering with the chronic pelvic pain, and you go for the diagnostic laparoscopy, you think, oh, I will find an answer for my pain, but they might not be able to find anything. So just keep in mind. If you had a laparoscopic removal of endometriosis, they normally offer you Mirena coil or combined pills for at least 18 to 24 months after the laparoscopic procedure, because it helps to suppress and it prevents you from having recurrence of endometriosis. So they will normally discuss with you these options in the clinic. If you had endometriosis before menopause, or if you think you have got endometriosis, just contact your GP, and then they can offer you, they can request investigation and refer you to the specialist, because endometriosis can still be active after menopause. And if you have been diagnosed with endometriosis after menopause, then they offer you a surgical treatment, and if you're not suitable for the surgical treatment, then they will offer you medical treatment. So yes, this was just the basic information about endometriosis. I hope I managed to clear your concepts. If you have any question, please let me know. I'll be back with another topic next week. Until then, please have a nice week. Enjoy your week, and I'll see you next week. Thank you.